So benign prostatic hypertrophy is something that happens to all men as we get older. It's very common, and it can affect the flow of the urine. The prostate is located immediately below the bladder, and as it gets older, as we age, it will affect the flow, leading to the very common symptoms such as peeing in the middle of the night, decreased strength of stream, etc. So very common, something that all men experience as we get older. So BPH, if left untreated, can cause significant stress on the bladder and can lead to bladder dysfunction and incomplete voiding. It can also, if left untreated, cause kidney disease as the backflow continues up into the kidneys, and it can hurt the kidneys. So it's something that needs to be addressed before it gets to that stage. Prostate artery embolization is a rather new procedure. It's probably been around about 10 years. It originally started in Portugal and Brazil, although the first initial papers were from Yale in the setting of trauma. But it is something that can be done, minimally invasive, that can shrink the size of the prostate and thereby alleviate the symptoms. So much like a cardiac cath, we go in through an artery in the hip or the groin, and we take a tube called a catheter and select the very tiny arteries on both sides that supply the prostate. We inject little tiny beads in those arteries, and over a period of time, several weeks to months, the prostate shrinks in size, and thereby treating the benign prostatic hypertrophy. So a common question I get is, how will this affect my sexual function? Very common question, and the answer is 0. It has absolutely no effect on the sexual function. So when comparing treatment options such as TURP versus prostate artery embolization, this is something to consider when choosing an option with your physician. So another common question I get is, what is the recovery like after prostate artery embolization? So it's a very quick recovery. There is no heavy lifting for 1 week, nothing heavier than 5 pounds. You'll feel a little sore in the artery where we went in for the procedure, but otherwise you can go about your daily activities, going up and down stairs, going for a walk, etc. You will have a Foley catheter in for the procedure. It's placed either by the urologist or by the nurse immediately before the procedure, and that can generally come out immediately following the procedure. It's an outpatient procedure, meaning that you come in the morning and you go home later that day. Very, very quick, very good recovery. In closing, thank you for spending some time with us today. If you feel like this procedure may benefit you, please visit our website at synergyrad.org. Our location and phone numbers are listed on that website, and I'd be happy to discuss this procedure either over the phone or in person. Thank you, and have a good day.